It began in late 2019, a time when the world was preparing for the new year, unaware of the storm that was brewing. A new virus, a coronavirus to be precise, emerged in Wuhan, China. Scientists named it SARS-CoV-2, a novel strain that had never been seen in humans before. This virus causes the disease we now know as COVID-19, which stands for Coronavirus Disease 2019. It quickly became apparent that this was not just another flu. COVID-19 spread quickly, becoming a global pandemic. Cities around the world went into lockdown, streets emptied, and life as we knew it changed dramatically. The virus spreads primarily through droplets. These tiny droplets are expelled when an infected person talks, coughs, or sneezes. These droplets are released when an infected person coughs or sneezes, and they can travel through the air, landing on surfaces or being inhaled by others. If you inhale these droplets, you can become infected. The virus then makes its way into your respiratory system, where it can cause severe illness. Close contact with an infected person also increases your risk. Everyday interactions like shaking hands or being in crowded places became potential hazards. The virus can linger on surfaces too. High-touch areas like doorknobs, countertops, and even packages can harbor the virus for hours, sometimes even days. Think doorknobs, countertops, even packages. These everyday objects became potential sources of infection, making it crucial to disinfect regularly. Touching a contaminated surface and then your face can lead to infection. The virus can enter your body through your eyes, nose, or mouth. This is why hand washing is so crucial. Proper hand hygiene can significantly reduce the risk of infection, making it one of the simplest yet most effective measures. The emergence of COVID-19 has been a stark reminder of how interconnected our world is. The virus spread rapidly across borders, highlighting our global vulnerabilities. It highlights the importance of global health security and rapid response to emerging infectious diseases. Collaborative efforts and swift action are essential to combat such threats. Imagine your cells as houses. SARS-CoV-2 has a key. This key is a protein on the virus's surface. This protein binds to a specific receptor on your cells, like a key fitting into a lock. Once attached, the virus can enter your cells. Once inside, the virus takes control. It hijacks your cell's machinery, turning it into a virus factory. The virus replicates, producing countless copies of itself. Eventually, the infected cell bursts open, releasing a flood of new viruses into your body. This process can damage your lungs, the primary target of COVID-19. The virus attacks the delicate air sacs in your lungs, making it difficult to breathe. This invasion by the virus triggers a complex chain of events within the body, leading to the various symptoms associated with COVID-19. Your immune system is your body's defense force. It's a remarkable and intricate system designed to keep you safe from harmful invaders. Think of it as a highly trained army, always on alert, ready to spring into action at the first sign of trouble. It's a complex network of cells and proteins that work together to protect you from invaders like viruses and bacteria. These cells and proteins are constantly patrolling your body, identifying and neutralizing threats before they can cause harm. When SARS-CoV-2 enters your body, your immune system springs into action. This virus, like many others, tries to hijack your cells to replicate and spread. But your immune system is always vigilant, ready to counterattack. White blood cells, the soldiers of your immune system, rush to the site of infection. These cells are specially trained to recognize and destroy invaders, ensuring that the infection is contained and eliminated. They release chemicals called cytokines, which act as messengers. These cytokines play a crucial role in coordinating the immune response, ensuring that all the necessary cells and proteins are mobilized to fight the infection. Cytokines alert other immune cells to the threat and direct them to the battlefield. This coordinated effort is essential for mounting an effective defense against the virus. Sometimes, the immune response is too strong. This can happen when the body overreacts to the threat, leading to an excessive and uncontrolled immune response. This overreaction is called a cytokine storm. During a cytokine storm, the immune system releases an overwhelming amount of cytokines, which can cause severe inflammation and tissue damage. Instead of just attacking the virus, the immune system starts attacking healthy cells too. This misguided attack can lead to significant damage and complications. This can cause widespread inflammation and damage to organs. The lungs, heart, and other vital organs can be severely affected, leading to critical health issues. The immune response to COVID-19 varies greatly from person to person. Factors such as age, underlying health conditions, and genetic makeup can influence how the body responds to the virus. Some people experience mild symptoms, while others become critically ill. Understanding these differences is key to developing effective treatments and interventions for those most at risk. COVID-19 affects people differently. Some experience mild symptoms like a cold or the flu. Others become severely ill, requiring hospitalization. Age and underlying health conditions can increase the risk of severe illness. One of the most serious complications is pneumonia. This occurs when the air sacs in your lungs become inflamed and filled with fluid. Pneumonia can make it difficult to breathe, leading to respiratory failure. In severe cases, COVID-19 can damage not just the lungs, but also the heart, kidneys, and brain. The virus can also cause blood clots, increasing the risk of heart attacks and strokes. Even after recovering from the initial infection, some people experience long-term effects known as long COVID. Section 5, COVID-19 versus the flu, a tale of two viruses. Both COVID-19 and the flu are respiratory illnesses caused by viruses. They share some symptoms like fever, cough, and fatigue. However, there are important differences between the two. COVID-19 is more contagious than the flu. It also has a higher mortality rate. This means that a larger percentage of people infected with COVID-19 will die compared to those infected with the flu. Another key difference is that we have flu vaccines. These vaccines help to reduce the spread of the flu and protect people from severe illness. While COVID-19 vaccines have been developed, it will take time to vaccinate a significant portion of the population. The emergence of new variants of SARS-CoV-2 adds another layer of complexity to the comparison with the flu. Section 6, Healthcare Systems Under Siege. The rapid spread of COVID-19 has put immense strain on healthcare systems worldwide. Hospitals have been overwhelmed with patients, leading to shortages of beds, staff, and critical equipment like ventilators. This strain on healthcare systems has had a ripple effect. Elective surgeries have been postponed, routine medical appointments have been delayed. This has led to concerns about the long-term impact on people's health. The pandemic has also highlighted the crucial role of healthcare workers. Doctors, nurses, and other healthcare professionals have been working tirelessly on the front lines, putting their own health at risk to care for others. The pandemic has exposed vulnerabilities in healthcare infrastructure and underscored the need for increased investment in public health systems. Section 7, Simple Steps, Big Impact, Handwashing and Social Distancing. We may not have all the answers yet, but we do have the power to slow the spread of COVID-19. By taking proactive steps, we can protect ourselves and our communities. Simple actions like hand washing and social distancing can make a big difference. These measures are easy to implement and can significantly reduce the risk of transmission. Wash your hands frequently with soap and water for at least 20 seconds. Make sure to scrub all parts of your hands, including the back between your fingers and under your nails. If soap and water aren't available, use hand sanitizer with at least 60% alcohol. Hand sanitizers can quickly reduce the number of germs on your hands in many situations. Hand washing helps to remove the virus from your hands and prevents it from entering your body. This simple act can be a powerful tool in our fight against the virus. Social distancing means keeping a safe distance from others. This reduces the chance of coming into contact with respiratory droplets that may contain the virus. Avoid crowded places and close contact with people who are sick. This is especially important in indoor settings where ventilation may be poor. When you do need to be around others, wear a mask to protect yourself and those around you. Masks can help block respiratory droplets from reaching others. These simple measures, combined with vaccination efforts, are key to controlling the pandemic. By working together and following these guidelines, we can help end the spread of COVID-19 and protect our loved ones. Section 8, Quarantine. Buying time, saving lives. Quarantine is one of the oldest tools in public health. It involves separating people who may have been exposed to a contagious disease from others. This helps to prevent further spread of the disease. Quarantine can be disruptive, but it's a vital measure to control outbreaks. It allows health officials to trace contacts, monitor symptoms, and isolate infected individuals. By slowing the spread of the virus, quarantine buys time for researchers to develop treatments and vaccines. It also helps to prevent healthcare systems from becoming overwhelmed. Public cooperation with quarantine measures is essential for their effectiveness. We all have a role to play in protecting ourselves and our communities.